Post-traumatic stress disorder, PTSD, is a mental health condition that can develop in some individuals who have experienced or witnessed a traumatic event. Traumatic events that can lead to PTSD include, but are not limited to, military combat, sexual assault, natural disasters, serious accidents, or other life-threatening situations. Symptoms: intrusive thoughts. Individuals may experience distressing memories of the traumatic event, nightmares, or flashbacks, where they feel as though the event is happening again. Avoidance. People with PTSD may avoid reminders of the traumatic event, including places, people, or activities that trigger memories of the trauma. They may also avoid discussing the event. Negative changes in thinking and mood. This can include feelings of guilt, shame, or detachment from others. Individuals may have difficulty experiencing positive emotions and may struggle with memory problems. Changes in arousal and reactivity. Individuals may be easily startled, irritable, have difficulty concentrating, and may experience sleep disturbances. Diagnosis. To be diagnosed with PTSD, symptoms must persist for at least a month and significantly interfere with daily functioning. Mental health professionals, such as psychiatrists or psychologists, typically use the criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, to make a diagnosis. Complication. Post-traumatic stress disorder can disrupt your whole life, your job, your relationships, your health, and your enjoyment of everyday activity. Having PTSD may also increase your risk of other mental health problems, such as depression and anxiety, issues with drug or alcohol use, eating disorders, suicidal thoughts and actions. Risk factor. You can develop PTSD at any age. Many risk factors play a part in whether you will develop PTSD. They include having had trauma in childhood, feeling horror, helplessness, or extreme fear, going through a traumatic event that lasts a long time, having little or no social support after the event, dealing with extra stress after the event, such as loss of a loved one, pain and injury, or loss of a job or home, having a history of mental illness or substance use. DSM-5 criteria for PTSD. Criterion AE, exposure to trauma, direct exposure to the traumatic event, witnessing the traumatic event in person, learning that the traumatic event occurred to a close family member or friend, experiencing repeated or extreme exposure to aversive details of the traumatic event. Criterion B, intrusion symptoms, recurrent, involuntary, and intrusive distressing memories of the traumatic event, flashbacks or reliving the traumatic event as if it were happening again, intense or prolonged psychological distress at exposure to cues that resemble aspects of the traumatic event. Criterion CE, avoidance, persistent effort to avoid distressing memories, thoughts, or feelings associated with the traumatic event. Avoid external reminders that bring back memories of the traumatic event. Criterion D, negative alterations in cognitions and mood, inability to recall an important aspect of the traumatic event, persistent and exaggerated negative beliefs or expectations about oneself, others, or the world, persistent distorted blame of oneself or others for causing the traumatic event or for resulting consequences. Criterion E, alterations in arousal and reactivity, irritable behavior and angry outbursts with little or no provocation, hypervigilance, exaggerated startle response, problems with concentration, sleep disturbances. Criterion FE, duration of symptoms. Duration of symptoms is more than 1 month. Criterion GE, functional significance. Symptoms cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. Criterion HE, exclusion. Symptoms are not due to medication, substance use, or other illness. Treatments. Psychotherapy. Cognitive behavioral therapy. This is the most widely used therapy for PTSD. It helps individuals identify and change negative thought patterns and behaviors related to the trauma. Exposure therapy, gradual and controlled exposure to thoughts, feelings, and situations related to the trauma can help reduce avoidance and fear. Eye movement desensitization and reprocessing. This therapy involves guided eye movements while recalling traumatic memories, aiming to help the brain reprocess the traumatic experience. Medications. Selective serotonin reuptake inhibitors, antidepressant medications, such as sertraline and paroxetine, are commonly prescribed for PTSD. Serotonin norepinephrine reuptake inhibitors. Venlafaxine is an SNRI that may also be used. Prazosin, this medication may be prescribed to help alleviate nightmares. Supportive therapies. Support from friends and family is crucial. Understanding and empathy from loved ones can aid in the healing process. Group therapy provides an opportunity to share experiences with others who have gone through similar traumas.